So for those of you who don't know, last week and this week I'm doing a YouTube live, and I may be doing one next Sunday as well at the same time because we're undergoing some reconstruction for my YouTube channel right now, just with the equipment and the cameras and the audio and just a whole different team. So bear with me while we're undergoing our construction site on my YouTube channel. And I just want to be here for you also to be doing lives, because Sunday is usually the day I post my videos, and I usually discuss topics that you guys are interested in or patients are asking me about. And then I felt like in this interim period, instead of not posting any content, I could at least do a live and be here for you, which I call office hours. So just if you guys have any questions in real time, you can ask me, and I'll be here for you to answer those questions in real time. So let me know though also if there's any problems, if you guys have any problems hearing me, or a problem with anything during this live stream, so that I can kind of like course correct and damage control and just fix anything that's going wrong. So let me know if everything sounds okay and looks okay, and I'll just be here. Hi, thank you Augusta for saying hi. So at least I have feedback knowing that this is actually working, and then I'll post it. So for those of you who miss it, you can go ahead and watch it at any time at your leisure if you want to rewatch anything or if you missed anything. Oh, good. I'm so glad you guys can hear me. Thank you so much. Hi guys. So this is really fun because I feel like my most active time where I'm responding to your comments and questions, which are so insightful. You guys have the best questions, is usually the day that I post my video. So that day, within like the first couple hours, I'm usually most responsive, because once the work day hits on Monday, I'm in the office seeing and treating patients, doing these procedures that we're all talking about, on social media and YouTube. I'm actually in the office doing these procedures, so I'm not, at my laptop or my computer answering these questions. But I kind of wanted to focus today on neck and chest, because I get a lot of questions on that, and I can answer any questions as well, but I wanted to be able to kind of focus it on neck and décolleté and chest. I'm like, let me show my chest and chest, because I feel like during the summer months, these are areas where people are coming into my office saying, hey doctor, I have chest creases, or I have brown spots, or redness, or photo damage, because I guess a lot of the times, we're protecting our faces, but we're not protecting our neck and chest. So a lot of people have been asking me about peels and chemical peels for the neck and décolleté and the chest, and they work really well. And yes, we do peels regularly to help rejuvenate the neck and chest skin, and that's probably my most common question that I've gotten asked by you guys regarding these areas. And you can often combine it with lasers or other injectables. Especially, we're getting such great results with Skin Beef. I even have it here. I even have it at home for myself. So Skin Beef for texture. Skin Beef is an injectable for correcting texture, and it's just been really impressing me with the results that we're getting in the clinic for improving neck texture, décolleté texture, chest creases, sleeve creases, things of that nature. And then you throw a laser on top of that, or a chemical peel, or other treatments, and it just knocks out the park. So I'll be talking about that as well, and that's a newer technology. So yes, you can use chemical peels for the neck and décolleté. It's a good adjuvant therapy to other treatments. If you wanted to do a laser or an injectable like Skin Beef or Radius, like a biostimulatory filler, it works really, really well. But you have to make sure that you're going to someone who understands peels and cosmetic dermatology, because you could also get post-inflammatory hyperpigmentation, or even worse, scarring. And if you're doing it at home, because there are some at-home peels that I know you guys have asked me about, lactic acid peels, glycolic acid peels, and other alpha hydroxy acid peels. You just have to be really careful that you're not using something that's too strong, and that your skin, is well conditioned for that treatment, that your barrier is intact, because it can, work against you, and you can have scarring if you don't do it appropriately. Also, if you use at-home devices, especially LED devices, I had 2 or 3 patients within the last couple months come in because they used an at-home chemical peel for their neck and décolleté, and then they also used either an at-home LED device, or they had an infrared sauna that they used at their gym, and they really had almost 3rd-degree burns, you guys. So just be really, really careful. So I'm all here for it to talk about anything neck and décolleté. I'm just looking through all your questions here. And so, okay, so this question, this isn't focused on neck and chest, but I get asked this a lot because I contradicted myself in 2 different videos. What type of collagen supplement that you want to use for skin benefits. And the data before was supporting marine collagen, but the most recent data at our academic meetings was the Vital Proteins bovine collagen. So that's why there may be a discrepancy with things I say in my videos, but I always keep you guys up to date with the latest and most updated information. And so things can change within a 6-month period with respect to recommendations and new technologies and new developments and discoveries. So if I ever say something that's not consistent, it's probably because, oh my gosh. It's probably, Daisy, if that's you, I'll call you back. If it's contradicting, it's usually because there's a new update in the information. So don't worry about that. And I'll always, keep you guys updated with the latest information. And if it's inconsistent, it's because there's been a new development. So someone asked me about licorice root peels for the neck and chest. I feel like there's better options out there, but if you're interested, there are benefits. Not a lot of sound clinical data behind licorice root, but that could definitely help with the neck and décolleté. Again, but just like with anything, a trichloroacetic acid peel or glycolic acid peel, just make sure that you're using an appropriate dose that's not too strong. Somebody said, let's see, I think we're kind of all over the place regarding not just doing neck and décolleté, but I'll try to pick those questions out. What lasers do oils help with? What laser do oils help with crepey skin on the neck? Please, I've tried everything. What laser do oils? So I'm not a big fan of oils for skin on the face, but for neck and décolleté, I think it does have a benefit without, having any negative responses in that neck and chest skin. Because remember, histologically, like under the microscope, the neck and décolleté skin is way different than on the face. The sebaceous gland density is different. The epidermis is thinner, the dermis is thinner, the barrier may be a little bit more, prone to irritation and breakdown. But you can use oils for your neck and décolleté. I wouldn't use oils on your face for other reasons, which I've gone into in my other videos. And you also want to downregulate sebaceous glands in the face. But in the neck and décolleté, it's fine. So for lasers for neck and décolleté, there's all kinds of different lasers, right? You have ablative and non-ablative. And then from those two categories, there's different lasers that kind of have different levels of strength, right? So clear and brilliant is one of the easiest, quickest, safest lasers to use. There's really no pain when you go to a medical practice and they use a medical grade numbing cream. There shouldn't be any pain at all. And then there's really little to no downtime. Some people will be red for about, a couple hours after the treatment. And then, you can go out to an event that night and nobody will know you had anything done if you had it that day. Fraxel's a step above. It's still a non-ablative laser, the Fraxel Dual, also known as Fraxel Restore, but it is a whiz at rejuvenating the neck and décolleté. So I'm 47 and I've been doing laser and Fraxel on my skin, more so because I was kind of being a guinea pig for myself, but since I was in my early 20s, and I think that this is the best thing that I've done for my neck and décolleté also, and under my eyes long term. So Fraxel is probably my favorite laser for neck and décolleté rejuvenation, and I have patients who are in their 60s and 70s who come and see me in their office, and whenever they have baby skin on their neck and décolleté, I'm always like, what have you done? Like, what's your secret? And it's always Fraxel. Fraxel Restore, non-ablative, like once a year, starting, if you can start in your 40s or even before, it's even better. Because remember, you're reversing sun damage, and reversing sun damage makes the skin looks healthier and more youthful. So when you have sun damage, like brown spots, loss of collagen and elastin, which translates to crepey skin or chest creases or brown spots or poikiloderma of Savant, which is a term that we use in medicine when there's like that ruddy hypervascular appearance to the neck and décolleté that results from sun damage. When you can erase all that, not only is your skin healthier, but it looks more rejuvenated. And people doing that over a lifetime, once a year, I always say a Fraxel of the neck and chest once a year is one of the best thing you can do going into your, later decades in life, because those are the people who have the best skin, and it makes sense. And the downtime is not too bad. It's not too uncomfortable, especially with numbing cream in the office, and it also reduces your skin cancer risk by 50%, according to a recent Harvard study that was done by some of my best mentors. So, Fraxel is probably the best. There is a CO2 and erbium and the more ablative, fully ablative lasers. I feel that those are more useful lasers if you're trying to really get out fine lines and wrinkles that are etched in, or you have acne scars. But I don't think, it's not my favorite. Those high aggressive lasers, like the fully ablative ones, aren't my choice for neck and décolleté. It's usually a Fraxel non-ablative, because I feel it has a less downtime, less discomfort, and the best results. So that's one of my key take-home points for you guys, if anything, to keep their neck and décolleté, looking youthful and healthy over time. But there's lots of different lasers to choose from, and I can go into lasers because it's my area of expertise at a later time, but there's so many different names. There's Fraxel, Halo, Fotona. There's so many cool peel. But you always have to look at the wavelength and the settings and what it's actually doing to the skin. And I'll teach you guys how to think a laser specialist or a dermatologist. Like you think of lasers by not the brand name, not like Halo, Fraxel, Platona, but you think of, okay, what is a wavelength? What are the settings? What area of the skin is this going to target on like a cellular level? What is it going to do? Is it going to stimulate collagen? Is it going to stimulate elastin? Is it going to break down scar tissue? Is it going to break down the melanin to even out hyperpigmentation? So I want you guys to start thinking like this. And if you follow me, you're going to start thinking like a dermatologist or like a laser surgeon, and you'll be able to make better decisions for yourself. So I want to empower you guys to do that, because when you think of skin on like a microscopic level and what goal you're trying to achieve and what devices or products you need to stimulate the skin to do that, you'll have next level results, and it's really empowering. So hopefully you guys can kind of educate yourselves, and hopefully this information is useful. Okay, so let's see. Somebody asked me if Moxie is better than Halo. So that's, that's like another question kind of on that same point. Moxie, Halo, don't get hung up on the names. Look at the wavelength, and I want you guys to think like doctors. Look at the wavelength and what is it doing? Is it ablative? Is it non-ablative? And look at before and afters. And not all lasers are created equal. I mean, people always confuse microneedling with lasers. They think Morpheus is a laser, and it's not. It's microneedling. Totally different technology, totally different mechanism of action, and it could be misleading. But if you're thinking, okay, microneedling, radio frequency, energy-based device versus a laser that's going to resurface the skin by a wavelength of photons that are targeting specific chromophores in a very elegant manner, it just changes your perspective of things. And so you won't be so caught up with like marketing and like names of devices. You'll be thinking of like, what type of device is it and what wavelength is it? And when you guys start thinking like that, then you'll be leap years ahead of everyone else. Okay, so somebody said, I found a laser specialist in New York versus local med spa because of you, and the skin has never been better. Oh, that makes me so happy. So yeah, if you guys want to watch my other videos on like how to find a good aesthetic provider, because there's so many people now in aesthetics, because it's a very lucrative industry, who cross over from other specialties. Like say they were a ICU nurse, and after COVID they don't want to deal with patients or insurance, and they want a cash pay business, and they're open a medi spa, so they're doing lasers and their injectables, and they've had 15 years of nursing experience but in the ICU, not doing injectables. So there's not a smooth crossover, and there's no regulation or accountability out there to kind of protect yourselves from having treatments done by people who are not properly trained or licensed. And so, I always try to teach my patients like what to look for when you go to a aesthetic provider, what questions to ask, where did they do their residency? Where did they get their training? How long have they been doing this? And they say, oh, I've been a nurse for 20 years. But yeah, like in pediatrics, or have you been injecting Botox for 20 years? Because there's a big difference. So I'm so glad you guys are finding that beneficial. Okay, I'm gonna keep going through these. It's so annoying because these little chats go away, and then I have to keep clicking on it to get it to come back up. So let's see. Okay, what treatments do you recommend for stretch marks? So this is kind of getting off the topic because we're trying to talk about neck and décolleté, but somebody asked me what would help with neck crepiness, and this is actually the same answer for stretch marks, and that would be usually a non-ablative laser, or ablative non-ablative like a Halo or a Fraxel, but I feel like lasers for crepey skin and for stretch marks are the mainstay of therapy with the most promising results. Now, there's other things you can do like microneedling, which I'm not a huge fan of, because I do think that there's a lot of complications, including fat atrophy and thinning of the skin with microneedling. And I've seen a lot of that in my office, people having microneedling horror stories happen to them, and they come to me to fix it. And so I'm not the hugest fan of that modality, but that is an option. And I think that those are probably the two best treatments. Elocore microcoring technology is another great option as well. So somebody else asked, let's see, thoughts of Fraxel Restore Dual for neck and chest, which we just talked about, which is my favorite device. And it's my favorite, you guys. I'm non-sponsored. I'm not sponsored by Solta, which is the manufacturer of Fraxel. I just really love their device, and when something new comes along that I like better, I'm not in contract, and I'm free to say, okay, well, there's something better now, and I recommend this for my patients. I only recommend what I truly feel is best for my patients, and that's the beauty of being non-sponsored. The downside is you don't have as many subscribers or followers, but that doesn't matter to me. What matters to me is that I'm able to freely recommend what I truly feel is best for my patients, and I can't be bought by a company or in contract to promote something that I'm not 100% behind myself. Okay, so somebody said, What is your opinion of Silphium with exosomes? So for neck and chest, I think Silphium is great. It's not one of my favorites, but I think it is a great treatment, and it has a lot of positive anecdotal data behind it. I'm not sure the clinical trials are that impressive with respect to the results, but I think it is a good treatment. Now, exosomes, I think, is a really hot topic right now, but you guys have to be careful because stem cells, exosomes, growth factors, could be a little concerning. And I have to tell you that this is from my educational background as a Mohs micrographic skin cancer surgeon. When we would do skin cancer surgery on our patients, we would always stop stem cells, growth factors, and exosomes on all of our patients. That would be on our intake form. That would be one of the things that we'd have to encourage our patients to do. So for me to be a proponent of exosomes and stem cells, I think that peptides and elegantly engineered scientific peptides are a lot more efficacious, they're a lot more elegant, and they're a lot less risky than some of the exosomes and growth factors. That's just my opinion as a dermatologic surgeon and as a medical dermatologist. But I know that there's a lot of hype on social media by skin experts, but you have to remember, where are these skin experts getting their education? Where did they go to school? Are they board certified in dermatology? Probably not, and it's kind of like a hot industry right now. But with exosomes, I just am always wary because you don't ever want to potentiate like a neoplastic activity. I'm not saying exosomes cause skin cancer, but I would rather use peptides that are more elegantly and more scientifically, very precisely engineered, as opposed to like dousing the skin with a bunch of growth factors, stem cells, or exosomes. So that's kind of my take on it. Again, that's just my opinion. I may be in contrast with other people out there, but just remember, look who you're taking your notes from and how educated these people are and where they got their education, because it does make a difference. Okay, let's see. Let's go through. I'm going through these backwards. Somebody said your neck is so beautiful. Thank you. I know it's always a work in progress. Hold on one sec. So somebody asked, I'd like to prevent thinning around my neck. So the neck and chest décolleté, skin is already thinner because, like I said, the dermis and epidermis are already thinner. Now, things that you can do to stimulate collagen and thicken the skin are, use of active ingredients, my MDR line, the neck tight serum, or even like using a retinol, which you have to be very careful on the neck and décolleté because that skin is thinner. The barrier could be easier to disrupt. But just remember, the same things that stimulate collagen in the face are, also applicable to the neck and chest. But because that skin is thinner, you have to baby it a little bit more. But doing things like using a tretinoin with caution, you guys, you have to use start low and go slow. You want to use a 0.025%, maybe mixed with, I can even do it for you right here. You do like a 0.25, do I have my tretinoin right here? 0.25 mixed with, no, I don't even have it here. I want to give you guys a demo. But mix with like 2 or 3 pumps of your hydrator, mix it in the palm of your hands and apply it to your neck and décolleté. That will stimulate collagen. I've seen a lot of misinformation online by people saying that retinol or tretinoin can thin the skin, which is not true. And I think this is where the confusion comes in. Let me just take this opportunity to talk to you guys about it now. When you look at the skin on cross section, there's different layers of the skin, and the uppermost portion of the skin is called the stratum corneum. That's where all the dead skin cells lay, and that's kind of like your protective barrier from your inside body being protected from the outside world. So you have stacks of these dead keratinocytes, which are kind of like dead cells that kind of live on the surface of the skin. And what tretinoin does is it kind of helps exfoliate those dead skin cells off. So you're thinning the stratum corneum, which is the dead skin cell layer on top of the skin. If you look at an older patient, the skin is kind of listless and dull and dry because they have a thick stratum corneum. That's not the thickened part of your skin that you want. You want that to thin out, and you want it to be thinner because that gives a beautiful uniform glow with homogeneous pigmentation and just like a beautiful glow to the skin. But retin-A, tretinoin, vitamin A derivatives do is they thicken the dermis, the papillary and reticular dermis, which is the lower portion of the skin underneath the epidermis where all the collagen is. So yeah, you're thinning out the dead skin cell part of the skin on top, but what tretinoin does is it thickens the dermis, and the dermis is what thins out over time as we lose collagen and elastin, as we gain wisdom and have birthdays. So you want that to be thicker. Neck and décolleté is the same. Now for me, I've been using tretinoin since I was in my early 20s, and I do use it on my neck and décolleté, but I only do it once a week, and I do, a 0.025, and I mix it with my neck tight serum, and I apply it to my neck and chest. And it took me a while to even get up to that momentum, but I wouldn't do it more than once a week because it could, be too irritating to your skin. So that's what I would do. Now, if you also wanted to stimulate collagen in the neck and décolleté, again, lasers are a great option. I wouldn't go with microneedling because, again, that can thin the skin and kind of backfire on you. I see it all the time from patients coming in from other offices having this complication. But then also Ellacor, Thermage, those are also great options to help stimulate collagen. Ellacor, not so much. Ellacor is more like a skin excision device that shrink wraps the skin and makes the skin, tighter by just removing skin removal, but not really stimulation of collagen. Thermage and other energy-based devices could help. I'm not a big fan of soft wave or oral therapy just because sometimes those results are a little underwhelming, to be honest. And hopefully we're waiting for something new to come along that can, be even better. But for right now, I would say that those are my favorite treatments for neck and décolleté stimulation of collagen. Okay, so let's just go to some of your other questions, and then we're gonna probably be wrapping it up in a few minutes. Somebody said, I'm so confused by tretinoin and glycolic acid. Yeah, so tretinoin can be confusing. Tretinoin is also known as Retin-A. It's a vitamin A derivative. It's a prescription strength cream, so you usually have to get it by a provider. I know there's some online stores where you can kind of, get it online through the black market, but just be careful, because unless you have a clinician who's actually seeing your skin and evaluating you in person, not just online or through FaceTime, but really like looking at your skin and prescribing you the right dosing and the right regimen, it can be really confusing. So I would say follow up with a provider or try like an over-the-counter retinol. My RxR retinol is a really scientifically engineered with next level technology to kind of have the most effective outcome with the least amount of sensitization. But I know tretinoin can be confusing. You can also refer to my video that I did on tretinoin and how to use it. The overwhelming data and support behind that active ingredient is really impactful. But again, it's prescription strength, so it's not over the counter. It's not like medical grade or anything of that nature. It's like a pharmaceutical. It's a prescription strength medication, also used for acne. And then if you're also confused with glycolic acid, all the acids, whether it's glycolic acid, lactic acid, they're all in the alpha hydroxy acid category, and they can all be used as chemical exfoliants. Exfoliants are just products that make that dead stratum corneal layer that we just talked about not too long ago kind of shed and thin out over time to reveal beautiful skin, and also to help with, normalizing and evening out hyperpigmentation, shrinking pore size, and all the textural and smoothing effects that alpha hydroxy acids have. Salicylic acid is in the beta hydroxy acid category, and that just has to do with molecular structure and more basic science, but that's more useful. The beta hydroxy acids, like salicylic acid, are more impactful for acne. So I wouldn't use sal acid for aesthetics so much, or for rejuvenation. Hopefully that shed some light on your question, but it can be confusing how many different actives are there and like how many different classifications are. Okay, so what are your thoughts on applying tretinoin without moisturizer for hyperpigmentation? I think that it's always good to use a moisturizer with tretinoin because it doesn't decrease the efficacy of it. If your skin's used to it and you don't want to use a hydrator or moisturizer, then that's okay. But usually people will use a sandwich method, or you pea the hydrator and then a pea-sized amount of the tretinoin and then sandwich it in with another layer of hydrator, or you'll mix it 1-to-1 in the palm of your hand and apply it to the whole neck and décolleté area. So let's see, can you use TO, glycolic 7%, and retinol in the same routine? So you can, but you have to be careful because titanium, I believe if the TO is a titanium dioxide, you have to be careful when you're layering products that there's no two products that can interact with each other in a negative, contraindicated way. I mean, like one's going to cancel out the other one. So in that case, that should be fine. But if it's, a personal skincare regimen, maybe someone can tolerate two different products in the same application cycle that someone else can't. Like, so I have patients who can't use a vitamin C and a retinol in the same application at the same time, but I have some who can. But it's not a matter of do they cancel each other out, or do they inactivate each other with respect to the active ingredients, but it's more, the overall skin health and tolerance to certain products. And people who have been using medical grade skincare or skincare actives, or taking care of their skin for a longer period of time, can withhold and stand a lot more aggressive skincare than others who haven't. It's like going to the gym. If you're conditioned and you've been doing a workout religiously every day, or 5 to 6 times a week, and you do the same workout as someone who's going to the gym for the first time after taking months off, one's going to be sore and one's not. One's going to have a harder workout and the other one's not, just because of the conditioning. So hopefully that makes sense. Okay, let's go to this. Let's see here. So are lasers contraindicated? This is so weird because it literally goes away. Somebody said, are lasers contraindicated in autoimmune disease? I was told risk of hypopigmentation. This is a good question, and this one comes up a lot, especially for the neck and décolleté also. So lasers can hypopigment the skin, which is a bigger problem actually than hyperpigmentation. Now, people who get depigmentation or hypopigmentation from lasers are usually the more old school ablative lasers, like your CO2 and your erbium. So when there's scarring, that can result in depigmentation or hypopigmentation. To be honest, knock on wood, I've never seen it in my 20 years of practicing dermatology. I've never seen it in my career. But when it happens, it's usually done way too aggressively, and the patient's usually out, under anesthesia, usually in a plastic surgeon's office where they're under anesthesia, undergoing a facelift, and the surgeon also does, a laser while they're totally knocked out and don't have that biofeedback to say, hey, turn it down, that's hurting. You want your patients to be very relaxed and somewhat, sedated with some type of analgesia. But if it's too much, you want to be like, hey, doc, you need to turn that down. And I think the biggest risk of hypopigmentation and depigmentation happens in those settings, where it's usually a plastic surgeon doing lasers, which plastic surgeons really aren't well versed in lasers at all, because they don't get that in their 8 years of residency training. They're in the OR learning surgery. They're not skin experts, even though sometimes they try to cross over. But that's when problems happen, and those are the biggest complications that I see as a laser specialist, when these outside jobs get referred to me to fix it, right? So what happens is scarring from an ablative laser like a CO2 or an erbium can happen. Now, autoimmune disease, you have to be careful with certain autoimmune diseases. Now, there's so many different autoimmune diseases and different pathophysiology behind each disease that I would always recommend, follow up with your rheumatologist and go over it with him or her. For example, lupus is a connective tissue disease that causes photosensitivity, and there's multiple forms of lupus, but some of them are contraindicated with certain lasers. Now, with respect to vitiligo, which is an autoimmune disease where your inflammatory cells come and they attack the pigment cells, so the melanocytes, that is contraindication to lasers in general, because any source of trauma to the skin, whether it's you bang your hand on a door handle, or you get hit with a laser, that's traumatization that can cause, it's called a kebnerization. That's in dermatology, that means there's trauma to the skin and it's going to ignite and flare the disease, so you can get vitiligo in those areas. Now, many people will mistake vitiligo for other things that cause lightening or brightening of the skin. Idiopathic guttate hypermelanosis. I hear myself talking and I'm like, Stephanie, shut your brain down, put it on two gears lower. But idiopathic guttate hypermelanosis is when people get little white spots, usually in sun damaged areas, and that's just from sun damage. So lasers are contraindicated in some autoimmune diseases, but not all. But you have to see your rheumatologist or have an appropriate workup. And then once you get clearance from your doctor, then you can see a laser specialist who really understands lasers and different wavelengths and settings that they can use to accommodate your skin type and your disease without causing harm. But I would not say it's a true statement to say autoimmune disease makes you contraindicated to having a laser procedure. It just depends on the actual autoimmune disease, and usually it's not, unless it's true scarring from a laser, in the case that I talked to you about earlier, it shouldn't be contraindicated, and that's more of just a complication that can happen to anyone, not just someone with an autoimmune disease. But I also want to say that Fraxel Restore, also known as Fraxel Dual, has been one of the only lasers shown to repigment depigmented patches, or just whiter spots or light spots, because the laser breaks down scar tissue, and that enables the melanocytes, which are the pigment producing cells, to kind of repopulate that skin and bring the pigment back. So I just wanted to mention that one as well. Okay, let's see what else you guys got going on. We only have a few minutes left, but let's see. What are some practitioner red, oh gosh, let me see, practitioner red, that just went away. Practitioner red flags For CO2 laser, it's been so hard to know who I can trust here in the UK when shopping for where to get tear trough CO2. What's the ideal setting for tear trough CO2? So CO2 laser, for those of you who don't know, is one of the best treatments for resurfacing the under eye area, which is, the thinnest skin on our face and the first to show our age. Even in our 20s, when we smile, we have wrinkles under the eyes because that skin is so thin and delicate. CO2, and there's other lasers that are great for under eye rejuvenation too, but CO2 is one of the mainstays of therapy to rejuvenate the under eye with respect to wrinkles. Now, people always ask, do I need eye shields for that? Now, it just depends. If you can pull your skin below the orbital rim, which is the bony part of the skull, right under the eye, if you're treating that area that's protected by bone, between the globe of the eye and the bone, you don't need those intraocular eye shields. We can usually put external shields over, pull the skin down, and CO2 on top of that skin. Now, sometimes if you want to get really close to the lid margin, or if you want to treat the upper eyes, you put an intraocular eye shield in. A lot of doctors don't know how to do this, and med spas for sure don't really know how. And so if they don't offer it, it's usually because it's just beyond their area of expertise, or I don't even know if they have expertise or whatever they're practicing. They don't know how to put an eye shield in, and they're uncomfortable treating the eyes. You wouldn't want those people treating your eyes anyway. For CO2, it depends on the CO2 laser, and I rarely give away my settings because it's the art of medicine, right, guys? It's not like I use some cookie cutter settings on the same every single patient. I look at their skin type, the skin pigmentation, their Fitzpatrick skin type, how thin or thick the skin is, the degree of laxity, how many wrinkles they have, and how deep are those wrinkles, how severe is it, and then I custom the settings for each individual patient, and I'll do maybe 1 pass or 2 passes or maybe 3 passes, and each CO2 laser is so different. For example, the CO2 core is a more innovative technology with less downtime, and patients tolerate it a lot better than some of the fully ablative like Ultra Pulse, Scar FX, Deep FX, Luminous. There's so many different CO2 lasers, so it's kind of like it's hard to say what settings would you use. But what I would say in finding a laser specialist is just go to someone who is trained and has a background in laser medicine. It's not like a plastic surgeon's like, oh, I rent this laser once a month. That's a huge red flag. A lot of plastic surgeons will just rent their lasers. I mean, how do you even, with each one of my lasers, it's like a car that's my car. Like, I know it, I feel it, I know the settings. I don't have to use a drop down menu. When these plastic surgeons sometimes are renting their lasers for their case that they're doing that week or that day, and they're just using the CO2 laser, that's a huge red flag. So say, do you own the CO2 laser? Is it in your office? How much do you use it? How long have you been using the CO2 laser? Why do you have a luminous instead of a core? You can ask, why did you choose to have this laser in your office, and who taught you, who trained you? They may say, oh, I did a weekend course in Vegas, or they may say, oh, I did a whole laser fellowship after my plastic surgery residency or after my dermatology residency, and that is the safest bet. It's harder to find people that have that level of training, but you guys, it's your face, it's your eyes. It's worth doing a little bit of research and going to a provider who you know and trust. And then also, when talking about a CO2, I would honestly go to either an oculoplastic surgeon or a dermatologist, because skin is our domain as dermatologists, and those of us who have extra level training in lasers is, puts the patient in the safest hands. And then oculoplastics is a different subspecialty of plastic surgery where they just focus on the eyes, because the eyes and eyelid skin can be really, really tricky. For example, if you tighten the skin too much, then you get an ectropion where your eyelids don't even touch the globe of your eye. Then you can get a corneal ulcer and need a corneal transplant. I mean, it's a whole mess. So I would just say, level of training. Why do they have the particular CO2 device in their office? Do they own it or do they rent it? Because that's kind of a red flag. If they're renting it, that means they don't do it that often, which, would give you some insight. And then, who trained you? How long have you been doing this? And let me see some of your before and afters. Not another surgeon who used the same laser. I want to see your before and afters of your patients and show me the results. And then I'll trust you to CO2 under my eyes. So that's the best advice I can give you guys. Okay, so it's been 33 minutes. So I wanted to keep it to 30 minutes and focus on the neck and chest. But next week, if we do a live, I can focus it on another topic, but I'm happy to answer any of your questions that you guys have, because I saw questions popping up that were really insightful. But these are my office hours, you guys. I love engaging with you, and thank you so much for subscribing and following. And next week, we might have a video for you, or we might do a live if we're not quite ready yet, but hopefully this YouTube channel will be under construction and out of construction, bigger and better than it was before. All right, you guys, thank you so much, and happy Sunday.